Nothing like sitting in the hospital room and a baby didn't make it. It's sad because that's what they want. They want a baby, and they just feel like, you know, I don't understand. Why me? Ohio is 47th in the country for infant mortality, 49th for African Americans. That means our babies are dying before they're 1 year old.
So a key indicator for us, and really for our entire community, and really this occurs across our nation, is to understand what an infant mortality rate is. And of course, that's the death of an infant before its first birthday. Sadly, actually, the most recent number was a bad number for Franklin County, and that was of 10 infant deaths per 1,000 live births. Wellness on Wheels, through the people you've been serving, the pregnant moms and the infants that are born to those moms, you've been doing a terrific job of actually being lower than that rate when you add up all of the women that you've served over the many years. That's terrific.
The mobile unit is a 54-foot semi-truck that has 8 rooms, 2 exam rooms, 2 counseling rooms, 2 bathrooms, a waiting area and a lobby.
When the unit first rolled out, I'll never forget going to see it. You see this big semi-truck pull up and you go in and it's a doctor's office inside. It was kind of like, if you build it, they will come, and they did.
The team is a multidisciplinary team that comes out to the high school sites. Currently, we go to 4 high schools and we run 5 clinics every week to provide care not only to the teens at the high schools, but also for all women in the community.
Particularly in our city, we noticed that areas of concern were around access. So transportation, being able to actually get to the doctor's office or to a clinic, was a big issue.
The program has expanded over the years to include mothers in their 20s and even older. So we're reaching out to the community to provide the prenatal care that's needed.
A good doctors will make you feel comfortable when you come here.
Having someone who cares, but having a place who actually is taking the time to figure out what's wrong with me and wanting to fix it, and still offering free service and still being really nice to you. You can't beat that. You can't beat that.
Our mission to improve the health of those we serve, we do that every day. And it's not just a vehicle. It's the people that are within the vehicle, the expertise that they bring to the table, and the caring that they take to their patients and families as they get out there.
One of the reasons we've been so successful is because we are blessed with wonderful nurses, wonderful dietitians, a fantastic social worker. The patients are really in need of not just medical care, but general guidance and just someone that they can trust.
What the mobile unit does that's different is we are treating the whole patient. We're not just providing clinical care. We are addressing all of the other social determinants that play into a healthy baby being born. Wellness on Wheels has 4 programs under its umbrella. The first is the Project to Reduce Infant Mortality, or PRIM, the School Ambassadors Program, sports physicals, and then a dental program in partnership with Nationwide Children's Hospital.
It's been over 19 years since I first had my encounter with the mobile unit, and it's still standing, and that is commendable. That's remarkable.
We really can't do this on our own. We really rely on the support of many people, whether they be funders or community partners who help us to access other areas that are important to the women that we serve.
If you really want to make sure you have awesome prenatal care and know that your child and your health is definitely going to be put first, that the Grant Mobile Unit is the best place for you to go.
We have been very heavily invested in healthcare ministries and in increasing access to care, particularly to the most vulnerable members of our society. And Wellness on Wheels is just a prime, stellar example of how we do that at OhioHealth.
I'm very excited about the future of the Wellness on Wheels. With your support as we move forward into the future, I'm looking forward to even expanding what we do within OhioHealth and the community.
You know, young girls or first-time mothers, they don't want to be treated like they're just somebody that they want to get in and out. They want to be treated like they're cared about. And that's how I was treated, especially with the high risk of the pregnancy. I don't think I would have been able to do it without it.